We want to welcome everyone this morning. I know this is the second to our last meeting for this grant year. We have one more in September. Kind of a bittersweet thing because I feel like we're a family. And I'm going to miss all you guys. But it's been a pleasure working with all of you. And we are happy to have Beatrice close out with us, and she started out with us. And I will be turning the meeting over to her because she will be giving updates regarding what's going on with SAMHSA and the closeout of the grant. Ms. Beatrice, it's over to you.
All righty, thank you. I'll try not to go too long on this, but I know that we kind of extended the time a bit on these last few calls just in case some things come up as we're nearing closeout. So a couple of things that I have on my little handy dandy sticky note here to mention. First of all, with the status of the no cost extension, we still haven't heard back from SAMHSA yet. I didn't expect to hear back this quickly. They said that they were going to try to get a response to everyone within 30 days. So hopefully within the next 2 weeks, we should hear back from SAMHSA about whether we are approved in full, whether we are approved partially, or whether the application was denied. And so we'll hopefully hear back from them over the next couple weeks. And as soon as we know, we'll let everyone else know what the determination was, what that's going to look like, everything from there. So to be continued on that front. In terms of other things to mention, we have a save the dates announcement where we're working with our mental health manager here at the department, Suzanne Snyder, and she's going to provide 2 trainings in September. There'll be an hour and a half each, and they'll be virtual trainings on Teams. And it's kind of a mental health 101, talking about mental health, about self-care, all these kind of basic things. And we're going to be sending that out open to all districts across the state, hoping for a good turnout. One, because it's very useful and valid information, especially here at the start of the school year. And 2, because we're hoping to get some more grant numbers for that, some training numbers for that. So save the date. It's the same training. They're just offering it at 2 different days and 2 different times to help people who may not be available for one and might be available for the other. So the first date is September 12th from 9 a.m. to 10:30 a.m. So September 12th, 9 a.m. to 10:30 a.m. That's a Tuesday. And then the following Tuesday on September 19th from 3 p.m. to 4:30 p.m. So following Tuesday, September 19th, 3 to 4:30 p.m. So save those dates. We don't have the approval of our memo yet from the department to be able to send it out on our listservs yet, but they are working on that now. It's going through the routing process here. So hopefully soon we'll have that to be able to, officially advertise it and send it out statewide. But for right now, just save those dates and let folks know that we'll be doing those mental health kind of 101 trainings, and Suzanne Snyder here at the department will be leading that, and hopefully get a good turnout for the grant. So let's see, I've already spit 2 things at you about the no cost extension and about the save the dates. Any questions on those bits or things that y'all want to bring up on those bits before I move on to some other things? I don't want to go too fast here.
Will you give those dates and time again, and I'll add it in the chat?
Okay. Yep. So Tuesday, September 12th, 9 to 10:30 a.m. And then Tuesday, September 19th, 3 to 4:30 p.m.
Thank you, ma'am.
Okay. Anything else on those two bits, or we're good to keep it rolling? Okay. Alrighty. So the next things that I have written down is that I will be sending out some more sustainability resources in the coming weeks, like this week or next week. I'm kind of gathering some things together based on sustainability discussions that we've had in the past as a group and separately, and also based on some resources that we received when we attended that AWARE pre-conference meeting before the Southeastern School Behavioral Health Conference. There was a lot of good stuff that came out of that that was emailed out, and I believe it was emailed out to everyone, but I know how things get lost in the mix sometimes. Some things stand out, some things go under the wire, and so kind of reviewing all of that, going to repackage that and send some of the highlights out, along with some other things that we have here for sustainability. So just heads up that there's going to be some more sustainability stuff coming your way. We don't have anything associated with that right now that is a SAMHSA deliverable, is any requirement. So I'm not asking anything of you regarding the sustainability stuff that I'm sending out. It's just for your information in case any of this is helpful in your districts and your organizations, just to have that. So I will be sending all of that out soon. And of course, if there's any questions on those things that I send out, anything that you want us to discuss or feel like you need from us anything further, then by all means, please let us know and we'll work on that. Let's see, that kind of segues also into another heads up. Even if we have applied for the no cost extension, of course, there's no guarantee that we will be approved for that. And there is also a limited degree of what we can do once that is approved, if it is approved. So we do still want to continue to move forward as if September 29th is our end date, because it officially is. And, just in case, we would rather be safe than sorry on that. So I'm also going to be sending out in the next week or so, this week. I'll send it out this week. I've already got some things together on that. And another email that does have to do with deliverables. So like I said, the sustainability email that I'm sending out, it's for your information. It's in case you want to review things that you feel like could be helpful. But this second thing that I'm going to be sending out does have to do with deliverables. It does have to do with what we have to, what we're required to submit to SAMHSA. So I'll be sending some prompts to respond to regarding year 5 activities that we've done, and then some prompts also that are kind of cumulative, years 1 through 5, just the grant as a whole. And those are things that that SAMHSA is interested in obtaining information about, things that I'll need those pieces of information to write the closeout reports that SAMHSA is requiring from the department. So y'all will be receiving that this week so that you have a heads up. Of course, the due date will be September 29th. So we're giving, as many weeks as we know we have left for us to receive that information. So we've got time here, got about 6 weeks or so to work on those things. But I'll be sending that out so that we can get that information before the grant closes out. Let's see if there's anything else on that information that I need to mention. No, I think that's it. I know all of you have also done the key informant interviews from Pyre, and thank y'all for that. I was looking through some of the prompts that they were asking to ensure that I wasn't, getting too much duplicate information. This is some separate stuff here that we need, but it is a collaboration here. And of course, as always, once we finish with this and have our reports written, everyone will receive the final reports. You can disseminate them however you want, whatever you think will be helpful or interesting to stakeholders. But we're just trying to make sure that we've got all of that for closeout. You'll also probably be hearing from Gertrude over the next 6 weeks about any financial stuff that we need closed out, or anything that we're working on that front. Again, when we receive word about the no cost extension, some of these deadlines may shift and change, and we might have some more time. But for right now, just to be on the safe side, September 29th is kind of is what we're looking at for deadlines, because we're not sure about the no cost extension. Okay, let's see. Before I move on again, I'll pause again. Anything in all those things that I spit out, that anybody have any questions on or want to bring up anything around, or? Okay. Alrighty, taking silence as feeling good about it. Okay. So let's see. Moving along on the sticky note. Since this is our second to the last official monthly call together, we have the one more that would be coming up next month in September. And just be thinking about what, if anything, that you may want from us or need from us on that call or outside of that. If there's anything specific that you would like us to do or need us to do for that call, let us know. If there's anything beyond just that call and you're thinking, oh, well, if we're going to end the grant, I want us to discuss this thing first, or I want us to be on the same page about that thing first, or I want these certain resources from y'all, or this type of help from you first. Be thinking about what you may want to discuss as a group, collaborate together, what you might need from us at the department or us as a team here. Just making sure that we have time to put something together or convene for another call or something like that, if y'all want or need something. So just be thinking about that, giving it, some serious consideration, because once we've passed the window, we can't be like, crap, what about this other thing? So we're just trying to make sure we think about that in advance. So just give that some thought over the next week or so, and let me know, email me, whatever you think, whatever comes up. Also call me, text me, y'all know how to get in touch with me. And outside of that, the last thing that I have down here is just seeing if there are already right now any questions about grant closeout or about the no cost extension, any questions about the department or aware, or anything that comes up that you are curious about or want us to discuss or need to know right now. Anything out there for any of you? Okay. I'm going to take that silence as we feel settled at the moment.
Beatrice, I don't know whether this is the right time, but I'll give everybody a chance to give you a break for a second, give everybody a chance to think. We're getting ready to send out the call for proposals for the 2024 School Behavioral Health Conference, which will be in Myrtle Beach again. the end of April. We are last year we ended up having to actually stop enrollment at the conference. So we're actually expanding this year, and we're adding some new areas of the convention center up there. So we're going to be able to have a few more presentations and some additional rooms. So I think this is a good time, while you're thinking about the end of the AWARE grant, thinking about some of the things that you have done. As always at the conference, we're very interested, not in just while we enjoy having some of our leaders come and present, people like the folks from MHTTC or from universities and so forth. We really do like to have practitioner kinds of presentations. So again, over the course of AWARE, if you have had something really unique that's been done in a school or in your district, or somebody that's done something great, because we're expanding, we're going to have more breakout sessions this time. There should be more opportunity to do that. And I would just like you to start thinking about that now. The call for proposals will go out at the end of this month, and it'll be open through November or something like that. But I just wanted you to think about that. The other part of that I would say is that MHTTC, even though our grant is ending, it is a Southeastern School Behavioral Health Conference, and they are going to continue to come, and will continue, like last year, to do some AWARE work with other states. And of course, you all, are always invited to attend the AWARE materials, even though we may not be officially AWARE anymore. You are, as AWARE districts, always invited, and AWARE partners always invited to attend to that. And I'll make sure through Gertrude and through, quite frankly, probably Suzanne Snyder, who Beatrice alluded to, some of the things she's got going on, make sure you get the information and get the invitations to continue to participate in AWARE activities even after our South Carolina AWARE has ended. So I would just wanted to make that point known. And there you go. I don't know if that was a good time or not, but that is a kind of sustainability. So there you go.
Perfect. Thank you. Anyone else with anything that they want to bring up now or ask about, or? No, it feels like I'm putting people on the spot. I'm just trying to give opportunity here while we're in the whole group. So if you don't have anything, that's okay. You don't have to think of something just to speak and fill an awkward silence. Just trying to give people some time and space and opportunity. All righty. So as usual, if something pops up, just reach out to me. Again, email, text, call. If something comes up. Sometimes things pop up at the weirdest times in the weirdest ways, and we're like, I gotta write this down. So you know how to reach me for that. So those are the things that I have as updates for today. And I guess if I don't have anything else to respond to right now, we can go into moving through updates. Is that where you want us to go, Gertrude? Oh, I think it's muted still.
Yes, if you're finished, then we can start with updates.
Okay.
We wasn't sure how long it would take.
Yeah.
So I've asked all of you to send your written reports. You can still send them. It will help with getting the report quicker done. But if there's nothing else, we will begin with Pyre. Dave?
All right. Well, thank you. Yeah, this is really quick. I'm usually quick, but this should be really quick, I think. Just a reminder about the getting information into the pad for the SPARs, that will definitely be continuing through September. If we get the no-cost extension for those that are involved, then it would continue longer, but we'll cross that bridge when we get there, and hopefully we do get there. But just thank you for all you've done with everything. The last SPARS quarter with the grant, the way it exists now, would be through the end of September. So data into the pad that's relevant to anything that's done through the end of September is really important for us getting through that final quarter. So again, thank you for what you've done in the past and what you'll continue to do here for just a little bit. We've been working, we're getting very close on having the full parent and staff reports done, staff survey reports and parent survey report done, and should have that out in the next week or so. So that's part of what we've been working on, and that is key for us in terms of if we do need to close out the project by the end of September, having all that done will just be helpful for what we need to include in the final report too. With everything we're doing, we hope we have a lot more time and are able to do a whole lot more, but obviously that's one of the things we wanted to do. The other big piece that we've been working on through the summer is the interviews. Elaine had been working heavily on that, and those were just completed, I believe, in terms of the end of those. And that information now we're working on pulling together. And again, that would be going into a report like we've done in the past on the interview findings. And again, a lot of that for us, what we're really hoping is to have time to work with it more for purposes of the final report. But if needed, that's part of why we're working on it so hard right now, is so that we have that information for what we may need to pull together by the end of September. So that's a lot of what we're doing right now, is really trying to complete reports that as we've done in the past and on this time frame, but also knowing that we may need to be going into double, triple time next month if we don't get the no cost extension to close everything out. So having these other pieces out of the way is kind of important and critical for what we're able to include in the final report. So that's the main stuff we're working on right now. That's the basic update.
Okay, thank you, Dave. Any questions for Paya? I've noticed our aware director, Ms. Aveen Coburn, has joined the meeting. Was there anything you wanted to bring forth, Aveen? We'll give you the floor at this time.
Thank you, Gertrude, for allowing me just to have a couple of minutes to share a couple things that we have going on in the office. Good morning to everyone. In the next couple of weeks, we will have a few trainings, our mental health trainings with Suzanne. I don't know if Beatrice and Gertrude have mentioned those. They will be in September. And we would love for you to have as many teachers and staff to participate. Hopefully that memo will go out today. Also, because you're aware partners, we're also doing a graduation Diploma Institute with the National Dropout Prevention Center. The first training is in August. It's in Greenville. August 29th through the 31st. The first day is a virtual training. The next 2 days are in person. The second workshop is here in Columbia during the week of the 11th through the 15th. And it's 1 day virtual, 2 days in person. And that's mainly to work with your graduation coaches to get students to graduate. The last date is in Charleston, which is that last week, which is the 19th through the 21st. If you want to attend those sessions, we'll gladly get that information to Gertrude so that your graduation coaches, your school personnel, especially at the high school, can attend those sessions. We will be having a lot of trainings coming out of the Office of Student Intervention Services. So we want to make sure that the aware partners are aware of those trainings. As a reminder, hopefully Gertrude told you that August 15th was some of your expenditures that needed to be in. So hopefully you've gotten those in as well for those federal expenditures. So that's all I have. I think I've covered everything. I know we're getting ready to close the grant out, and we appreciate what you've done so far and all the support and working with students.
Aveen,
Yes.
This is Kathy
Mhm.
Morris. What training, can you give us an alert, kind of a view of what you're planning for the future? So that I can, allude to that to the people who supervise me, because when it comes up so soon, it's almost, that we can't come. But if I could get them to plan ahead, that these people will need to attend a training in December or January. And I know you don't have it down specific, but if you have some in your mind that you're thinking about, like I know that there went out a memo about threat assessment training.
Yes.
And then is there any CPI training going to be offered? Are y'all anticipating that within this year?
Yes, we do anticipate some additional CPI trainings. They did offer some in May, July. Suzanne should have some dates for later this fall. The behavioral threat assessment, because we're also working on a no-cost extension for that grant, which is the GSIM grant. We're expecting trainings in October, November, and December for the behavioral threat assessments. And we have some coming up in September, but very few in September. Most of it will be in October, November, and December, as long as we get that no-cost extension. So we're working on 2 different grants that are ending in September, and both must get that no-cost extension.
Okay, and I'm asking that because that would be part of our sustainability, was having hopes that y'all would, when they're looking at how they're going to budget this year without aware funds,
Yes.
can they look at some of these trainings department? Okay.
Yes, the
That's-
department will still offer behavioral threat assessment because it's required in state law. So we will continue when this grant goes away, but we're trying to make sure we use as much of those dollars to get this as many as we can in the next year of the no cost extension.
Okay, thank you.
Any other questions?
Okay, if there's no other questions, Linnell, Department of Mental Health is up next.
Good morning. Let's see. So school is back in session already. So we have been busy. Our clinicians have been busy, getting geared up to get back in place in school. We are still recruiting for some of the year 5 positions in Anderson. We have filled a few in Sumter and PD this year. We have some Safe Talk T4T trainings coming up this month. One in Anderson that will be happening, and Teresa can talk more about that when she speaks. And one in the Florence area as well in September for Suicide Prevention Month. And of course, if those slots are not filled, I think there's a few in Anderson. If anyone in the community can participate and take in those trainings, that is part of making this initiative sustainable to be able to offer that. So if you have churches or other agencies, or you and your organizations have individuals that want to be trained as a trainer for Safe Talk, please, engage them and have them come for the training. We are still working in Sumter to get our sustainability plan together. So I'm so sad that Kathy's leaving, because she has been a real advocate for us in that area. So, with the new superintendent they have there and everything, we're hoping that we can have a plan in action so that we can continue school-based services in that community. And Lee, did you have anything that you wanted to talk about with school mental health?
Yeah, nothing major. We're able to get the salary increase for our first year therapists. So from the State House, so that's a positive thing. So we should be able to, we are seeing some of those positions that we've been wanting to see get filled. So that's exciting news.
Yes, that's major for us. And that's going to help a lot with us securing positions. So I'm very, very happy about that. It's impacting a lot of budgets, but it's good for recruitment. I think that's all I have right now. Any questions?
You took the words right out of my mouth. If there are no questions for the Department of Mental Health, we are with Federation of Families. Hi, Deanna.
Hello. Can everybody hear me okay? Awesome. Yeah, so we have pretty much wrapped up all of our summer wellness activities, so the wellness boot camps. We had the one in Sumter at the beginning of June, and then we had one in Anderson mid-July, and then we did a wellness fair in Florence. That was the most recent one. That was towards the end of July. And we've got a bunch of wellness kits to give out to youth in the districts. So we were able to give out about 50 at this event, which was pretty good considering how last minute it was a little bit. But we're going to continue to be giving out kits. So that's what we're doing for the rest of August. I'm getting in contact with a couple different places in Sumter, Anderson, and Florence to just have some opportunities to pass out some kits because we've got a whole bunch of them. So hopefully we get that done, at least a good portion of them out by the end of August. And then September, we're going to be doing kind of like mini wellness boot camps. They're more like wellness workshops. We're going to be having 2 in each county, and they'll be like 2 hours long. They'll either fall on a Monday, Tuesday, or Wednesday, so that we're not kind of competing with athletics, so like football and JV, varsity, college, things like that. And then they'll be held after 5, so that youth who they can come after school, and then if they have any extracurriculars, they can come after those. We'll also be offering workshops for parents to promote parent wellness, and those will be offered at the same time, hopefully in the same location, but separately, so they won't be held together. Yeah, and we are still kind of like getting our location secured. So the dates are still kind of tentative, but we will have those nailed down by Friday. And I've already got flyers and Eventbrite links for registration kind of like generated. So once we have everything fully solidified, I'll be able to fill those in, and then I should be good to have them to everybody by Monday. And I think, and then the other thing, we're going to be doing a movie screening in each of the counties. The movie is called My Ascension. It's a mental health story from one of the people that we've been supporting throughout the years. And we're currently in talks with different theaters in Florence, Sumter, and Anderson to get those screenings like scheduled. We have to like rent out some of the theaters, and then we're looking at a community venue option for Sumter. So once we have that information solidified as well, I'll be able to send out flyers and things like that for that too. So I think that covers all the stuff I needed. Are there any questions?
Okay, hearing none. Thank you, Deanna.
Thank you.
Nami had to leave. Bill was unable to join the call, and Laura had to leave for a school presentation. I have their report already. It'll be coming out to everyone. So we move on to Bob. PBIS.
Yep. I'll try to make this quick. We've been doing a lot of pre-service training in Sumter and in Florence 1. I'll be doing additional MTSS training in Sumter coming up at the end of the month. And I have a number of classroom visits. These are specific classroom visits to visit and assist teachers that are having specific difficulties with classroom management and might be helped by PBS in the classroom. I'll be doing that up in Florence once the school year gets a little bit further along. So in a couple of weeks, so we can go in and provide some assistance there. That's really where we are finishing up, and it's been a good summer. A lot of PD in a number of places. That's gone well. So that's where we are. I would remind everyone again that we will be starting the planning for the conference. There's one other thing that is going on, working with Lee Fletcher, who's on the call, and also Suzanne Snyder, who we mentioned earlier. We have a small opportunity to create what we're calling a learning community under the direction of the National Center for School Mental Health and also the Center for Disease Control, who are funding. And so there's going to be monthly learning community calls on a variety of different topics around school-based mental health that folks can participate in. There's been some interest expressed in Florence 1 for participating in this. We hope they will. Other districts across the state are participating. So if you have an interest in joining a learning community, monthly virtual calls from national experts on mental health, let me know, and Suzanne and I and Lee will get in touch with you to do that. I would say that also has a student leadership component where they're going to doing training for student leaders in schools that are interested in working in this area. So if you have, this is unlike what Federation of Families is doing, was working a large group of students. This is just for students leaders who might lead groups like Federation of Families are doing. So it's an opportunity for them to communicate with other folks across the country as well and get some insight from experts in that. So that's where we are, and I will stop there. And I want to thank everyone for all the good opportunities I've had to spread the word about PBIS and MTSS in districts. It's been a great experience, and I know we have one more call, but I just felt like we need to thank everybody. It's everybody here has been so gracious to me personally, and also PBIS. So thank you so much.
Thank you, Bob. Are there any questions for Bob, PBIS?
Gertrude, I wanted to thank Bob for presenting to our alternative school teachers and directors in July. July 26th, we had rave reviews. They have requested that Bob come back and talk about PBIS and the multi-tiered support interventions. So we hopefully will be able to get Bob again to make some more presentations, but the directors and teachers truly enjoyed that session. And we appreciate Project Aware for allowing that to happen, to be a cross-office collaboration.
You're welcome. If there's no other questions for Bob, Anderson too, Teresa, you're up.
Good morning to everyone. It's like Gertrude said, a bittersweetness almost of next to last time. I tell you, we're excited over the past 5 years where we have grown in our district with mental health awareness. So thanks to Project Aware for that. But also coming to the end is a celebration, but also a sadness not to interact with those who are retiring and moving on. I feel like I'm the only LEA that's left behind. You guys are leaving me. But we're excited for your retirement, and I know it'll be a great opportunity for you all. Just to share a little bit that we did have some Tier 1 PBIS efforts that were done at the beginning of school year with 2 of our elementary schools. I want to take just a moment to share just the progression here in Anderson School District 2. Every school probably had something different going on as far as Tier 1, and PBIS was probably non-existent in most. And we have just flourished throughout our district with PBIS efforts and Tier 1 supports from elementary to high school. And so that's exciting to watch that grow. And I appreciate just the support of everyone with that effort and helping them to see the evidence-based piece to it, the effectiveness and the efficiency of that. So glad to have that in our elementary schools. Those were probably 3 of the last elementary schools that took this voyage to go PBIS efforts. They had some other things that they were really hanging on to and didn't want to let go, but we are there, and so it's exciting to see that growth. We also grateful to be trained as an ACEs trainer and use that in our district. And so we have used that in different capacities. I met with our bus drivers, just important for them to know how vital they are to the school and letting them be that link to families. And they're the first person and the last person that they see the children. So was able to provide ACEs training for our bus drivers at the beginning of this school year. Also with our school nurses, I met with them and worked with them on training with our suicide screener and our protocol. That's been a blessing in our district to support those who have those needs. And so just to empower our nurses as being yet another person in our buildings that can facilitate those suicide screeners and reach out to the mental health professional if that is a high risk or if there's a concern there. Then also we have updated our suicide prevention, monitoring, and post-vention flow chart and protocol procedures. That is something that is just a work in progress, and I'm so grateful that we have that. But we've added another step. We had a high number of EMS calls last year, and so just wanted to empower our mental health professionals that are in our building to be that go-to person and to ensure that that happens. So we did adjust that a little bit. Last year, we made a little change in it. We added the after school hours piece and making sure that 988 was a part of what we do after school hours and making sure our coaches and those that are involved with our students have access to that and know about that. And then also we are doing a district-wide tool of a list basically, or a resource tool for tiers of support for our behavioral concerns. What we found is that teachers truly say, I'm doing everything I know to do. And so we just want to give them the tools at their fingertips so that they can try some Tier 1, Tier 2 supports before that Tier 3 step happens. In our district, we kind of did that a little different, I guess, and maybe you all did as well. But we had those Tier 3 supports in first because of DMH and bringing in mental health clinicians, which is great. However, we had to take a step back and say not all students need to be referred for mental health counseling, but what can we do in Tier 1 and Tier 2? And so I've gotten permission from DMH, our local DMH, to tweak that referral or request for assistance a little bit. And I require our school counselors to write that down as to what Tier 1 and Tier 2 efforts have not been successful. Now, understanding that there are those crisis moments that we definitely need to get Tier 3 supports in, but it's just helping our school counselors and our teachers and administration to be responsible for what's happening in tier 1 and tier 2 in their buildings, and making sure that's helpful for our students. So those are some changes there that have happened this year with Aware in our schools. Looking forward to a huge training that's coming up with an effort that we're doing with PLC and professional learning communities. And this year we're adding the behavioral piece district-wide. So that's exciting. That's coming up thanks to Aware. Thank you very much. Any questions? Oh, Linnell, I almost forgot. Don't let me forget that. Safe Talk Train the Trainer is happening August the 30th and 31st in Anderson at Anderson County Library from 9 to 5. We are shy one person to meet requirements. I have shared that with so many different ones, but if you know of anybody in your area that needs that training and wants to join us, it will be in room A in the Anderson Main Library, downtown Anderson. And it is August the 30th and 31st. Thank you.
Send me that in an email, Teresa, so I can send it out after the meeting.
Okay, thank you.
Any questions for Anderson too? If not, we will do our farewell presentation. Jamie from Florence 1.
Good morning. Yes, this will be my last meeting, and I just appreciate all of you for helping me through this process, because I came in towards the end of the grant after Lisa, who did a lot with the grant. So I really want to thank you all for helping me get through this process, especially Teresa and Kathy, who are the LEAs who I called and asked questions of. I don't have a lot to report. I've been trying to tie up loose ends. My last day is the 29th. I've been interviewing and helping my SBTs with getting referrals. They've been very, very busy opening cases. I do want to thank Bob. Bob has been working with Savannah Grove Elementary with PBIS. So I thank him for providing them with lots of resources to help with the students throughout the school year. Linnell, I know you mentioned the Safe Talk T for T for Florence. We do need to work on filling those spots. So I do want to have that kind of done before I leave. So we do need to, I am working on that. I don't know. We have PD mental health counselors in our school. We have 6 that are actually being paid for by our superintendent, but we actually have 8 that are going into our schools, but 6 that are actually being where our superintendent is paying for a portion of their salary, but we actually have 8 total. We have a couple of new ones that we have added to our schools. So that's basically all I have. Does anybody have any questions for Florence 1? We do have some prospects for my position. We'll know, and I'll give you that name, Gertrude, before I leave.
Okay, great. Is one of them yours? You're going to stay to the 29th of September? Is that one of them? You're muted.
No, it's my last day is still August 29th, but the person that's going to be my replacement is an in-house person that's been with us for a while. So.
Okay, great. We wish you well.
Thank you.
Any questions for Jamie? If not, we'll move on to Kathy Sumter.
Good morning. And of course, this too is very bittersweet for me. I don't know if it's easier to say goodbye or if it's easier to say, be the one leaving or being the one staying, because this job has been quite exciting, it's been challenging as much as it's been. I've appreciated the opportunity to work with y'all throughout these months. With Sumter School District, I first want to say that we are very much welcoming the school-based mental health counselors from mental health back into our schools. I mean, it really is rewarding to be able to see that meet them, to get to see the feelings that they have about what they're going to be doing and working with them. I want to thank Linnell for that background work that she's been doing. And Lee, also thank you for it. I knew it took some salary. That's what I heard, was salaries were the problem. So whatever you did that way, that was a big help. And I thank you for Project Connect. We have an alternative school director who's very happy, and he's calling that his reason for celebration for the year. So I'm very happy for that. And Bob, we certainly appreciate the help that you have done with our classroom management classes for our new teachers. That was very helpful, and for what you will be continuing to do in that area with PBIS. And NAMI has been very helpful with working in our communities. So they're not here for me to tell them, but I appreciate all the help they did with the park event, which is our event, and work getting supplies out to parents in the county. So I think they contributed a lot. The grant, we had some supplies that we could send with the grant as well. We began school early, which has been a challenge for the school district. So this is our first year going back to school early. So some deadlines slipped up, and it was a push. But we did have the opportunity to have our lawyer, Meredith Sieber, present to our administrators. And I say she's a contracted lawyer. She's not hired by the district, but we did contract with her to emphasize the legal aspects of not addressing mental health issues now. And seeing that, even though the Aware Grant may not be here next year, the need is still there, and the reason for doing it is still there, but it goes beyond just the legal. But she emphasized that with them at the beginning of the year, because I wanted to set that tone that stays. We've been working on, we had our emergency procedure flip charts go out, which included the suicide prevention. We've updated the numbers in it, and we've also worked with that evaluation with Dave. We have been subcontracting for MOUs with MOUs in our community with private agencies as well as our state agencies to have school-based mental health providers in our schools. We're a large district with a high Medicaid population, and the district did not. We still have a position for a school social worker open. It's been open for about 2 or 3 years now, and I wish they'd come up on the salary, because that might help get somebody hired. But we have had as far as mental health staff, we have had the same problems that mental health, Santee Waterloo Mental Health had, and the private agencies that we work with are dealing with the same issue of not finding the personnel in this area to work with students. But we've stretched out, we've reached out to agencies in Columbia. So, private agencies in Columbia. So we now have 8 MOUs that we've done, assigned in different schools. So we're working as best we can to get the services for our students in our schools. So that has taken quite a bit of my time, is working with those MOUs and working out the procedures and the process. Basically, we are working those sustainable issues. Mental health is perked me up a lot. Just yesterday, I learned they had a new counselor. So we're coming out of that after COVID situations that we're in. And just to let you know, district-wide, we didn't even have an MTSS coordinator when Aware Grant started. So there was nobody doing MTSS. We didn't have student support team meetings when the Aware Grant started. And now we see that our student support and safety team meetings are those meetings that are part of MTSS Tier 3 type meeting, And our schools have come a long ways in seeing the importance of working it into our procedures so that staff understand it's part of their job responsibility, which was first important. Seemed like that was important. They had to know it was part of their job. And then the second thing is having the resources to do it, and then the cooperation from the agencies that we have. Our procedures, like yours, Teresa, there it says MTSS. You know, has the teacher done that? Level 1, what have they done? Level 2, you know, what services? And then always has that option that if this is immediate concern with, you know, with severity, to move to the referral to mental health. So we've made giant steps through the district, and you know, having our suicide procedures very on paper, for instance, is really important, and having a flip chart and having the mapped procedure ready for the schools, and then just having the staff being aware that of mental health issues now. The awareness is increased greatly. So we're not perfect, and but we have our hearts our hearts are working in the right direction. So thank you very much for all of you and all that everybody has done. Appreciate it. And that's it.
Great, great. Thank you, Kathy. Yeah, we do appreciate you. And hopefully with the next meeting, you'll be able to say I was bittersweet goodbye.
I'll hold on to September the 29th right now. Okay.
Are there any questions for Kathy in Sumter School District? If there are no more questions, we at the close of the meeting, there have been a few emails sent out that we need you to take note of. We do appreciate you. If there's no more questions or concern regarding the August meeting, then we wish you all a blessed day and enjoy the rest of your week.
Thank you.
Stopping the recording.
Thank you.
Have a good week, everyone.
Thank you. Bye.
Bye. Have a good
Bye.
week.